Hello there, Rochelle Insurance Girl, just for the health of it. Today we are tackling maternity coverage. Who needs the maternity coverage? Who wants to pay for it? And should you not need it, you may not need to pay for it, right? So let's break it down here. I get a lot of calls from folks asking me about where can they go get coverage. Women call early in pregnancy. Maybe they don't have any coverage. Maybe they don't have maternity coverage, and they need to know where to go to get coverage for the remaining of their maternity. Now, there are two places where you can always get that coverage. One is going to be on a traditional employer group plan. It's mandated that they cover maternity, and it's not a pre-existing issue there. Whether you're midway through your pregnancy, you can get onto a group plan and get coverage for that. The other place is going to be on the Obamacare exchange. And of course, there's going to be some enrollment period limitations there. A pregnancy is not a qualifying event to qualify for a special enrollment period for an ACA plan. So typically that's going to come in November, December, where you can enroll in the plans for 2021. This is why it's a good idea to talk it through, if you're able to, with an agent, your family planning, because there are some considerations there. There are some private plans out there that cover maternity, but on those plans, and there's only a few of them, it's going to be necessary that you have the coverage in place before you become pregnant. So my clients and associates that are self-employed, that are self-paying for their health coverage and family planning, a lot of times if they're self-employed, they're not getting a big subsidy with the Obamacare plan. So they may be paying some pretty high premiums, and they may have some pretty high deductibles with the Obamacare plans, as well as group plans. We're seeing higher and higher deductibles with them as well. So when we want to look at our coverage for maternity, we're going to look at, is there a copay or is it toward the deductible? That's where sometimes we need to get creative cost-wise, because the typical deductible on an ACA plan, that's the Obama plans, those are going to range between $5,000 and $7,000 typically. Now you can get lower deductibles on there, but the premiums do go up quite a bit. And even on employer group plans, we're seeing higher and higher deductibles year after year. $4,000 or $5,000 is not at all unusual to see on a group plan these days. So we want to cost analyze. Should there be coverage for maternity? Does that mean that you pay the full deductible and then another 20-30%? Is that going to be a $7,000, $8,000, $9,000 bill in some cases? Or is it just a copay of $500 with your coverage? So we always want to cost analyze that. If it is the case where it's a high deductible and a high premium, maybe we're going to keep that person on a plan that doesn't cover maternity and explore the supplemental plans that will cover some maternity, as well as the prepaid maternity plans from the hospitals. These have become very, very popular with couples that have very high deductibles and couples that don't have maternity coverage. So I have a couple of clients right now that are going through their maternity, and they are using prepaid maternity plans because when we cost analyzed, it actually was less out of pocket. Now these two couples, both mid-pregnancy, one is expecting to pay around $3,500. By the time they leave the hospital, it'll all be paid in full because they're making payments throughout the maternity. The other couple is closer to $4,500. So I haven't seen any regular delivery plans that are over $4,000. So there is, that's always going to vary. It's always going to be hospital specific. But should someone find out they're pregnant, they can go to the hospital of choice and purchase a prepaid maternity plan. Again, the payments are going to be made, and typically the hospital bill is paid in full by the time mama and baby is discharged from the hospital. So it can be more cost effective. It's always going to be good to have a catastrophic plan in place though. Of course, we never can predict what could go wrong or what could happen during delivery or a pregnancy, and we never want to take any chances. So it's my job as that health advocate, as that healthcare advisor, to make sure folks know all of their options and to educate folks to be empowered on the decisions they make for their healthcare. So if you would like to receive my top 5 tips for maternity coverage, you're going to text me to 727-389-3037. your name and your email address, and I will send you my top 5 pro tips for getting coverage for maternity. This is Rochelle Insurance Girl, just for the health of it.